Hello, YouTube world, friends, family, subscribers, and viewers. Welcome back to Rebirth. I am your host, Robbie Williams, and today we'll be covering another segment of the 411 information on the coronavirus update, part 3. I'm going to start with Florida, a side note on Florida, because I'm a Floridian and we're just going to touch on Florida just a little bit because our governor, Ron DeSantis, came out yesterday and he had a press conference and he talked about the coronavirus. And he also talked about focusing on Floridians and he mentioned things that they should do. Well, first of all, he mentioned an update about 56 new cases has come out. And these are presumptive positives, but we have 56 new cases of the coronavirus, totaling up to the new number 216 in Florida. Now, as of March the 17th, the USA total of diagnosed cases is up to 6,500 cases with 114 deaths. This is by the COVID-19, which you well know. And since then, Ron DeSantis decided here in Florida that nightclubs and bars will be closed for the next 30 days. Now, this is something that I mentioned in my first video, that we need to be careful about going to these clubs. And today, or the 17th, if you will, he has stated that the bars and nightclubs needs to be closed, shut down for 30 days, so that we can monitor this virus, so that we would not put people in harm's way in person-to-person contact. Staying home can help a lot because when you're not saying you're isolating yourself, but this is more or less like a self quarantine. You decide to stay home more, stay out of the public, stay from around large numbers of people. This will help because this virus is not airborne. It only contacts and transmit from person to person contact. So that, I think that was a great move by Governor DeSantis. So let's see how it works out. New CDC recommendations came out as well, starting immediately. And for the next 8 weeks, the CDC recommends canceling all large events. And we're talking about, whether it's talent shows, you name it, people coming together for like family reunions, large events. They would like to see these numbers back down to like 10, maybe 15. That will help as well because you don't know who has what, just like they don't know who has what. The only time it's out is when we get a presumptive positive, and then the second test falls into play, and then we get hopefully we get a negative, but it all depends. So that's the only way we're going to know. Moving right along, we also learned that beforehand, we know that older adults this disease will be transmitted easily to them. And we're talking about people 55 older, some in 50s, early 50s. But we're looking at older adults, people with chronic illnesses such as lung, heart, diabetes, and kidney disease. Diseases like that makes it twice as likely for a person up in age to easily be transmitted that disease. So the COVID-19 can easily transmit to them because they already have medical issues or illnesses that they are dealing with, the body is dealing with, making that immune system even weaker. So take precautions, take those extra precautions to reduce your risk of exposure. Avoid contact with people who are sick. And this is what we need to do to take these precautions. So avoid people that are sick. Wash your hands often. And we're going to go back over the same thing we've been covering in previous videos. Avoiding touching your face, eyes, and nose. Avoid crowds, especially in areas that those places puts you in close proximity with other people and in small areas where there's poor ventilation. So we want to make sure that everybody is taking those precautionary measures. Avoid all unnecessary traveling. If you don't have to get on a plane, don't get on. Cruise ships, it ain't time to cruise right now. We just had a cruise ship shut down. So let's be careful about making these moves right now. Let's chill. Let's look at trying to develop. Everybody in every home need to look at your number of rooms, how many bathrooms you have, and come up with a plan, a home plan. And this plan will help you when it comes down to someone getting sick in the house. So what you want to do is develop an action plan so that you want, if someone is sick in your home, you want to have them in an area there's less traffic. You want that room to be the room that there's the least amount of traffic. They're close to the restroom. Then you want to make sure that you're doing your cleaning, your sanitizing, and things like that. You want to keep that up. Choose that room carefully. Separate the sick from the members that are healthy. If anything persists, if illnesses, if symptoms, things get worse, you need to call your PCP, primary care doctor. You want to call your doctor and get advice. If he tell you to come in, go in there. If things persist, what will end up happening, they will end up calling the local Florida Health Department, and it probably will get to the point where they will have to quarantine that person. If that happens, accept it, roll with it, cooperate. Let's not get in a situation where we are not cooperating with medical professionals that know what they're doing. Now, I also ran into some information about UNICEF. UNICEF also have a list in where they're saying that here are some things that can help. And they mention some of the same things that we're mentioning over and over again, but it doesn't hurt. When you blow your nose, remember to wash your hands. When you cough, cough into your arm like this. You want to make sure sneezing and coughing here. So you want to make sure that you are blocking that excess droplets going out into the air, because that's the mucus. That's where corona hides at. Okay, so we want to make sure that we do that. When you use public transport, remember, always keep. I know sanitizer is something that we're losing that resource right now. People have bought it up and just buying it. It's hard to get our hands on hand sanitizer, but if you do have some, keep it near you. Keep it in your car. If you use public transport, you want to wash and sanitize your hand when you get off the bus, especially transit buses that take you around town. You want to get off, go into a restroom, wash up, use hand sanitizer, keep it moving. Handling money. You want to do the same thing after you go to a store. You handle your money. You want to hand sanitize, wash your hands with soap. Money, animals, or taking the garbage out. You want to do the same thing. When you visit these markets, going to Winn-Dixie or any of those market Publix, you name it. When you finish, you want to do the same thing. You want to wash up, hand sanitize. You want to do everything that you can to prevent your exposure to corona. This is what you need to do. Another thing, churches. If the churches, I advise the churches, get your hands on some hand sanitizer. Try to work with the people in your churches. They come in there, they're in close proximity. So, maybe we may have to hold off on some of these services. This is just a precautionary measure. But if they come anyways, try to provide them with some hand sanitizer. It won't hurt. When you're caring for sick people, that's another thing to remember. We just mentioned that. You want to keep wash, you want to keep clean, you want to keep those hands clean, you want to use hand sanitizer, So keep it going. Eating, before you eat, after you eat, wash, wash, wash. Using the toilet. And not only that, when you have babies, changing these children, when you're doing that, before, after, wash, wash, wash. Use hand sanitizer. Okay, notice that whenever you notice your hands more than anybody, keep an eye on your hands, see whether it's need to be washed, another extra wash, or what have you, when it gets dirty. Keep that up. When you visit public places, these are things, touching anything in the public surfaces, like going to a restaurant and you sliding a chair back, you handling these things. Have your hand sanitizer with you. WHO, they call it WHO, the World Health Organization. They also mentioned that respiratory disease can spread efficiently in weather, not necessarily because of the temperature, but they're also saying that, but because human beings come in together in close environments, and therefore transmission is more likely, is more easily facilitated. When you look at the seasons, you're looking at, let's say, the winter and the summer season. Wintertime, people mostly come closer together, whether they're standing up in the clubs or standing up outside or whatever, they're closer together because you gather more heat that way. Summertime, people are more a little bit distant. You have to be careful. So the less you go out, the better you are. So this is why they're saying that. Just be careful on how, because you respond to the weather. All right. If you are asked to be quarantined, if a medical professional, health department comes to you and say, hey, you need to be quarantined, do not fight with them. Don't argue with them. I'd rather for us to comply and be safe than to try to do our own thing and make matters worse. So let's work on compliance. If these health authorities have recommended limiting your physical and social contact with others due to this pandemic, comply. You can always contact people via email. You have social media. You can text. You can use video chatting, video conferencing, or just making a simple telephone call. There are many ways you can talk to someone and stay in contact. Hey, that's my information for you today. Thank you. This is Robbie Williams, your host of Rebirth. Please don't forget to like, or subscribe to my channel, YouTube channel, to receive more upcoming content. God bless you all.